Hi, this is Dr. Doug Willen. I'm making this video today from my home in Brooklyn, New York. My office is in New York City, in Manhattan, and we're closed at this time. I'm a chiropractor and clinical nutritionist and author of a book called Quantum Paleo. So, a question that I have, and I thought many other people might have too, is can we get COVID-19 twice? And what I specifically mean by that, which is important if we're going to look at this video today, is let's say you get sick and you test positive for COVID-19 and you recover. Months later, can you get it again? Years later, can you get it again? Now, we don't really know, but there's a lot that we do know so far, and let's take a deeper look at how we can build up an immunity with any virus, how the body works that way, how we can develop antibodies that help us in the future. And we'll also look at what we have seen in the news so far with reinfection of COVID-19. So I made up a few slides. Let's just go through some. Here's something interesting that came out yesterday. So today is April 19th, and yesterday, April 18th, on the CNN online blog that they have, they said their title article was "Recovered Coronavirus Patients Are Testing Positive Again. Can you get reinfected?" So they specifically, the article was about what's happening in South Korea. Health officials are trying to solve a mystery where 163 people who recovered from the coronavirus have retested positive again. So that means that they got it twice. Now, was this an error or does it really happen? And let's look a little deeper, but that was put out by the Korean Center for Disease Control, which is exactly like our Center of Disease Control in their country. It's their bureau for that. So in South Korea, the proportion of cases was low. They tested 7,829 people who had recovered from the coronavirus. 2.1% retested positive. So it's not clear how many of the people who have recovered have been tested again, but that's what we do know. And it's not such a low number that we're not getting any data from it. It's not a big enough number to make any determination. So China, Japan, South Korea have all reported cases of repeated infection of the coronavirus in the last month or so. So let's take a little look at what happens in the body and how we can potentially build up an immunity. So when a pathogen, like a virus, a foreign infection, such as a virus or a bacteria, enters the body, and in this case, let's say you pick up the COVID-19 virus from exposure. The immune system first has to recognize it as an alien. So we have an immune system that identifies that entity that entered your body as not part of your body. It's not a good guy, it's a bad guy. There are specific blood cells whose job is to patrol the body and quickly send out an alert if a new infection potentially is encountered. So that's a good thing. That's what we want our immune system to do. Now, this alert stimulates the immune system to start producing very specific antibodies for that specific infection. So if you have COVID-19, you need specific antibodies to deal with the COVID-19 virus. This process takes time, as a certain level of antibodies need to be produced to overcome this specific infection. And this is why it's challenging. Meanwhile, the infection starts working into your respiratory system, and it's really a race against time, how deeply the virus can embed itself and infect your body and how quickly your immune system can fight it. Because right now there is not a vaccine, and there's really nothing we can do except to control secondary infections and make you more comfortable while your body hopefully is fighting this. So during this time, the virus, in this case we're talking about COVID-19, is multiplying rapidly. And it may take a few days or even a few weeks for your body to get the level of the antibodies. So it's building up this system of antibodies needed to fight off the infection, during which time you have the symptoms of the infection. You're sick. So when enough antibodies are produced, the infection is finally overcome and you start to feel better. That's what we want. The people that are dying, they're not able to produce enough antibodies. Their immune systems are compromised. A lot of the people that are in danger of dying from this disease already have compromised immune systems. They might have diabetes, heart disease, autoimmune diseases. They might be elderly. They might have a fragile immune system already. And those type of people have a difficult time creating this scenario in their body fast enough to overcome the devastating effect of COVID-19. But when they are able to do it, you finally turn that corner and start to feel better. Now, what we've seen with people going on ventilators is that when it gets to the point that they're not getting enough oxygen, that they're not able to, that their saturation level of oxygen drops too low and they can't get a breath, the ventilator keeps them alive, hopefully not long enough, again, since we don't have a cure or a response till your own body's immune system kicks in enough that you overcome this infection. So good thing is this is what we want. We want memory cells to work for us. The immune system then does something really clever. It produces memory cells. And these memory cells are ready and waiting should the same infection enter your body again in the future. And that's how we develop an immunity, because our body remembers what COVID-19 looks like. It remembers the blueprint. It takes notes and memorizes it. So when the infection, you're exposed to it again, let's say you get over this, you recover, and then 4 or 5 months later in September, someone coughs on you with COVID-19, your body immediately responds and handles it before you even usually will express symptoms, which would be great. If that happens, they're immediately activated. So if someone did cough on you after you recovered, all the way 4, 5, 6 months later, or even a year later, before it even takes hold and makes you feel unwell again, the memory cells send out much quicker messages now because there's a protocol in place in your body, and it makes your immune system come into action like that, and you handle it. So in this case, your immune system works so quickly you don't even feel unwell or even know that you had any exposure. This is because you now have immunity to that specific infection. And this is what we're hoping for with the COVID-19. In such a mass, when this happens to, depends on the stats you look at, 60 to 70% of the population, or 80 to 90% of the population, depending on which research you're looking at, we call this a herd immunity, H-E-R-D. The immunity usually will last for a lifetime, but it depends on the virus and not always. So most experts believe that there are 2 ways out of this pandemic. One is that in the next year, year and a half, whenever we can make this happen, we'll develop a vaccine against the virus. And this will allow rapid immunity to those who are administered the vaccine. So instead of you having to go through that whole cycle of getting infected and hopefully recovering, where your own body makes enough antibodies to overcome the devastation of the virus, and you turn the corner and win, if you were getting a vaccine, you could get that download rapidly and you will be able to skip the step of being gravely ill. Or number 2 is enough people may get the virus through its current mode of spreading that we're seeing right now, and a natural immunity will develop among the population of the planet Earth called herd immunity. And there's that word that we just mentioned, where enough people are immune to it that it can no longer multiply and spread, and the rate comes down, and we start to eradicate the virus or see the numbers drop, see the graph flatten so much that it becomes something that we're handling. So, like I said, it depends which article you read. I just took a quote from this one here that I saw in the New York Times. It is thought that roughly 60% to 70% of the population would have to be exposed to the coronavirus in order to achieve this type of herd immunity. So there's 4 reasons why we may be seeing the reinfection, and let's look at that now. Number 1 is people might be getting reinfected with the virus. This is not what's thought to be true, but that would be the most obvious answer, right? I mean, that's what would come up, like you just get it twice. So you get it, you recover, and then you get hit with it again, you get exposed, and then you just get another whole bout of the coronavirus. Now, like I said, this is not what the experts are thinking, but it is a reason that is remotely possible. I don't think number 1 is valid personally, or I shouldn't say that. I don't think number 1 is why we're seeing the cases. This one is a little more interesting, that the virus might reactivate in some people. So some people, they developed some memory cells, they developed the antibodies, they developed some resistance, but they are still weak, sickly individuals, and there's still enough remnant of their virus that they now are testing that they're clear, but by being exposed again, it reactivates. So again, none of this is known. We're all figuring this out, but I'm just going over what I read and just sharing that information. Number 3, the test might pick up harmless fragments of the virus, of the genetic material of the virus that can linger after a person recovers, because some of these tests are very sensitive and this is possible. Let's take a look. So finding remnants of the virus. For now, the most likely explanation of why people are, so this is the most likely one, number 3, is that people are retesting positive because it seems to be that the test is picking up remnants of the virus. So they have developed an immunity. The people that are getting retested, like I mentioned in the beginning of the video, from Korea, 163 cases, maybe it was a 165, I have to look back, I don't remember, but they had a remnant of the virus, they retested again, and these cases are coming in very mild, by the way. So we're not seeing retest and then someone dying. We haven't seen any of those yet. So according to Kwan, which is one of their lead researchers in Korea from the Korean Center for Disease Control, he said these tests may still be picking up parts of the RNA even after the person is recovered because the tests are so sensitive. And they're picking up any like little remnant or fingerprint left of that virus on the RNA level. And that's one possible very strong explanation. So Dr. Kwan feels that that's the numbers that they've seen. And so they're not really that worried that we're going to see a lot of that. So number 4, it's possible that there's faulty tests. And I think this is really possible because there's intra-physician or test taker reliability, right? So the way that I perform the test might not be as thorough as the way a different person, or how are they testing in different parts of the world. We're now testing a lot here in the United States, not as much as we need, but the numbers have come up where we've tested more and more people each week. But let's take a look at what I'm talking about, okay? Because this test needs to be done a certain way, and look how invasive it is. So they take this long Q-tip, and they don't just go into the like little outer part of your nostril or just like swab your tongue and put it down on a petri dish. No, look at this picture. They go all the way back. That is very uncomfortable. And you could imagine people flinching away. You could imagine maybe some test takers are not willing to aggressively go in and hit that back wall. And, you know, so it's intense. So is it being done reliably? Are you getting the sample? And when that Q-tip goes all the way to the back, is it hitting a specimen that will show up on the test? So I think what could happen in that case, let's say someone is sick. They go to a testing center. The swab goes all the way in the back. It hits the back wall. they put it on there, but it didn't pick up a sample of the virus, and it comes out negative. Now, this happened to a patient of mine. She was running a fever of 103 degrees Fahrenheit for a few days straight. She went to a testing center. This was in California. She lives on both coasts, New York and Los Angeles, and they told her she was negative. She went home. She did self-quarantine. She went back and retested, and finally on the second test, it showed positive. So imagine if you could see that there are false negatives and false positives. So I'm going to do another video probably in the next couple of days more on different types of immunity, specifically the herd immunity. I'm curious of reading a little bit more about that, and I'll report back to you. But people who are confirmed to be immune, so this is some of the takeaways. So if we find out who's immune, they could leave their homes again and help the workforce and the volunteers and healthcare workers that we need to be available if the numbers continue to rise and if our frontline healthcare people become ill. I know here in New York, policemen, firemen, transporters of people taking people to the hospital or to the facilities where they're being treated are getting sick, as well as the nurses and the doctors right in the hospitals. So we're going to need replacements, and it would be great if we could replace them with people that have proven to have an immunity. Growing immunity in the community also is a way that the epidemic will finally end. With fewer and fewer people to infect, the coronavirus will lose its toehold, and even the most vulnerable citizens become more insulated from the threat. And so the takeaway, to sum it up, is no one knows for sure. Part of it could be from faulty testing. Part of it could be like Dr. Kwan of Korea from the KCDC in Korea says that it could be that the tests now are so sensitive that they're picking up fragments of RNA left over from the virus, even though the person has healed or is immune now, but they're still going to show traces of that in their sample, their testing sample. We'll talk more about it. Leave a comment. I hope you like this video. Please subscribe and stay well and stay safe.